Unboxing TNT, a podcast that unpacks contemporary national issues and advocates for more effective representation and innovative solutions related to those challenges facing all of us. Tune in for fact-driven insights and stakeholder perspectives, and learn how you can do your part to make a real difference. Subscribe on YouTube and follow on social media for updates. Now, let's get started with this episode of Unboxing TNT with your hosts, Anarion Mason and Rudolph Hanamji.
Hello, 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 and welcome to episode 10 of Unboxing TNT. Today we're going to be looking at the Trinidad and Tobago National Budget 2024 to 2025 and the topic of health. I'm Rudolph Hanamji, and I'm so happy to be once again joined by Anarion Mason, my co-host. Anarion, episode 10.
Thank you, Rudy. It's quite a pleasure to be here, and I must remind our subscribers, hit that like and subscribe button, follow along on Instagram, Facebook, TikTok, and our part, X, sorry,
Yes.
at our part for all of them. And yes, Rudolph, this is health. And what are your thoughts on debate?
Well, it's very similar to my background, actually. If you can tell, it's a photo of the foreshore at sunset time. Actually, I took that on my birthday this year when I turned 40. And
Right.
I felt that we are still in the sunset of our healthcare system because there was no further development, as far as I'm concerned, of innovative policies that will exponentially and expeditiously transcend the challenges that we are facing with our national healthcare system. To me, it was much of the same and a number of high-level promises and commitments. But
Right.
I know we're going to get into the clips later on, and our viewers can judge for themselves.
Of
So
course.
that's why I chose my background today. What about you?
Well, a lot of people who knows me know that I love fruits. And to me, fruits is one of the best ways to start the morning. Once I have it my way, I tend to have a fruit salad on mornings, a mixture of local fruits like mangoes, papayas, the ever so often kiwi. I hate apples in fruit salads though. It seems so unwanted.
I
At least,
actually had apple in my salad for dinner tonight.
ooh, that's good. I don't mind apples. I just don't like it in my fruit salads because you get apples year round now. It's no longer a Christmas thing.
I know, that's interesting. I remember when it was just at December, November, December time.
Correct. And it's become overdrawn, I should say.
And
But
also, just quickly on health, a number of those fruits, they are treated and imported uh, from far distances, and the treatment allows them to stay fresh. But I really and truly prefer our homegrown organic fruits myself.
right, likewise. And I tend to wash my fruits very, very thoroughly
You should, yes.
before ingesting because there are lots of different preservatives that they use to keep it looking good and having it shine when it's not even supposed to be shiny.
Mm-hmm. Yes.
So and that's the reason I chose my pitié for the topic of health because it's one of my go-to to keep myself healthy in the diet realm.
Well, I know that eating is I mean it varies, but it ranges somewhere between, they say, 70 to 90% of your health is really about what you eat. Everything else is complementary, right? How much
Right.
sleep you get, exercise, mental health and wellness. But you need to nourish this one body that we have. And unfortunately, not everyone in Trinidad and Tobago is able to do that. And therefore, they have to turn to the healthcare system, especially
Right.
those that
And
don't afford private healthcare.
as we go along through the debate, through whatever other topics we talk about on health, such as the UN reports and things like that, you'd realize that NCDs, or non-communicable diseases, which are lifestyle diseases, is very
Yeah.
rampant and high in Trinidad and Tobago. And it all stems from what it is you eat. It's a lifestyle disease, and based off of that, that's where we get so many different things taking place. Because, for example, as simple as people liking to eat chicken or going to KFC and fast food, those poultry are treated with hormones that grow for quick growth and turnover.
Mm.
And that in itself gives you a human who's ingesting hormones that is not necessarily needed by your body, and thus we have the rampant obesity across the country.
Particularly in children. Trinidad and
Yes.
Tobago has one of the higher rates of childhood obesity and other NCDs, as you mentioned, per capita. So
Mhm.
perhaps that's a good segue point. You want to explain to viewers how we will be approaching the next few episodes and then introduce the first segment? Because I think the
Okay.
structure is important that we've chosen.
So the next few episodes, viewers, boys, girls, women, children, is going to take the format of presenting the UN current state analysis. And then we will tie that to the Vision 2030 document as to where the country should be. And from there, we will move on to the actual debate with the respective line minister and opposition shadow minister. From there, we will also look at the SFC, the Standing Finance Committee report on the specific sector, where the opposition raises questions and the administration would answer those questions where they see discrepancies or things like that. And finally, Rudolph and myself will comment on certain topics within the sector itself on our point of view, and from there, we close off and take you to our next episode.
There you have it. So we've tried to apply a methodology, a structure over the next few episodes as Anarion outlined. Because at the end of the day, our role here at Unboxing TNT is really to begin presenting information in as an objective manner as we can, because at the end of the day, this is to ensure further accountability and genuine representation. As per our name, the portal for accountability and representation for Trinidad and Tobago. So we're hoping that you all out there in YouTube and other platform lands will be able to appreciate some of the perspectives that have been shared throughout the budget debate and form your own opinion, at least understand some of the areas that perhaps more questions need to be asked and where you should be considering advocating for national policy. But as Anarian said, it's important to have a baseline against which you gauge the recommendations for this fiscal year that we are in and that will end next year September. So Anarian, what do you have for us first up on the agenda here?
So first up, you would see um, a graphic that shows wrong graphic really the other one or the line graphs.
All right, let's switch that over.
Sorry about that, folks. Very slight technical difficulties. But this graphic goes on to show where the country is in regards to the various NCDs. I thought it was necessary to show that as I discussed some of the topics that came out of the several reports that we would have read based on the UN and the WHO and PAHO. So the graphic shows, like I said, a lot of the different non-communicable diseases as well with regards to the age, the percentage throughout the country from the statistics that they would have done.
Mhm.
Now, health indicators from the various reports that was read, there are several topics, high-level topics that I would like to discuss. And that starts with maternal and child health care.
Mhm.
They have made the reports indicate that we have made strides in reducing child mortality and improving maternal health services that the country has met for different challenges before. Now, this report was done at the end of 2023, and we all know during the early months of 2024, we had some severe issues with the Port of Spain NICU, where
Mhm.
there was, I think, about 17 to 21 confirmed deaths of children post delivery.
Right.
I don't think it will set the progress back when you look at it per capita, but it is still something that we need to remember. And every life of every child lost is a significant loss.
Of course. And Anarion, just for viewers' benefit,
Hmm.
the key says that the blue dots represent where we're at, and the yellow represent where our targets are by 2030, right?
Correct.
So, so for
We are
viewers out
behind
there,
in most.
we are okay. So I'm reading it correctly then. Okay.
The next major thing coming out of the different reports were the
Mhm.
non-communicable, the NCDs, that is can never be able to pronounce, is non-communicable diseases. There you go.
There you go.
Such like diabetes, cardiovascular diseases, uh, cancer are the leading health concerns in the country. It is crucial that that persons understand they account for over 60% of the population's morbidity rate. And despite efforts in public health awareness and prevention, it is still high because, like I mentioned in the earlier in the conversation, it is a focus on lifestyle changes that the population needs to take. So, in other words, what it is needs to be done in this instance is proper advocation and a change in culture and mindset of Trinbagonians to want to be healthier. You know that saying that goes, it don't affect me or it don't bother me. I've been
Well,
smoking, I've been eating
yes,
this, and nothing went on, so they don't really
people
care.
put these things out of their minds. But it- but
Exactly.
but this is exactly where there is a natural intersection with the education system, agriculture,
Mm-hmm.
and we mentioned this in at least two or three of our previous unboxing episodes, where when you look at the economy, when you look at the ecosystem, the different sectors, you should start appreciating that each one intersects with the other. So we're
Yeah, they don't operate
spending
in
a
silos.
lot of money on healthcare. And what you're
Actually,
saying,
it is the
Anarian, is
largest. It has
sorry?
received the largest slice of the pie in this national budget.
Yeah, it did exactly. And what you're saying is that if we look at some of the other areas and perhaps enhance the levers in those spaces, it may have a positive knock on effect, and therefore we may need to spend less in the health sector.
Right. Now, moving on to healthcare access and quality. The WHO, who is the World Health Organization, reports improvement in healthcare access to essential services, including broader availability of primary healthcare and essential medicines. Now, remember, these are based on statistics and a small population that they take surveys from,
Right. Yes.
and it
But
is based
still,
on per
it still
capita.
gives us. Yeah, still gives us an indication.
But ideally, the average citizen will complain and state that they don't get proper healthcare access, they don't have access to medication and things like that. So there is the catch-22 situation where the global entities who are reporting on Trinidad and Tobago indicates that we're there. However, local persons will see something different.
Of
And
course.
that's where we need to separate that divide and have them come together. But again, you can't interview 1 point something million persons to find out what their
Mm.
healthcare access is like.
And that is why, under our various projects, we do intend to go directly on the ground and engage with different stakeholder groups and the individuals that are directly impacted by these issues, because we've recognized there is a disconnect between the high level data and what's happening in everyday life here in the country. So I'm glad you raised that point. And if you're out there and you have a passion for a specific sector or area, if you work with an NGO or CBO, or just as an individual, you want to be a nation builder and help us here at our part, feel free to contact us at we must do at our part. That's with two T's .org.
And whilst you're organizing to write down that email address and reach out to us very fast, very quickly, I must do like the Minister of Finance and the Prime Minister, like they always refer back to 2020 and 2021 with regards to our emergency preparedness and health infrastructure. The reports indicate that the COVID-19 pandemic showed the robust health infrastructure, how important it is, and how Trinidad and Tobago has worked on strengthening its capacities and its capabilities and preparedness. However, the reports indicate that they don't think Trinidad and Tobago is quite there yet in the instance of another global pandemic.
Okay, yes. I remember reading that at some point, and I thought it was an interesting takeaway because you could get fooled.
Hmm.
We did relatively well in
We
our
did because
response
I
to
think
COVID-19, but it doesn't mean
we
that we're
assisted
ready,
some
right?
of our neighboring islands as well with
Yes,
vaccines and things like that
yes.
because we have, as a lot
We
of people
had
like to term it,
surplus.
oil and gas money, and we were able to help. Now, a major challenge coming out of the several reports that I want to touch on is data availability and digitalization of the healthcare system. That
Hmm.
there are significant gaps in data collection within the recent years to monitor patients' healthcare across constituencies and across the border. So, in essence, what it's saying is if you go to San Fernando General and you go in for something like, let's say, kidney failure, but they discover that you have a mass somewhere on your body and they need to send you to Eric Williams Medical Complex, which is part of the Northeast. Is Northeast or Northwest? Northwest, for that regional area.
Hmm.
They have to call into San Fernando and ask San Fernando to send the information, and then it may take a day or two via courier to reach the port to Eric Williams. What should happen, or what is the recommendation, is that they digitalize records and patient data so that it could be accessed from one server. If it is I type up Rudolph Hanamji in Eric Williams, I will get the same
Makes
information in
sense.
San Fernando,
Yes,
in Port Spain, or in
yes.
Point 14, etc. And I think you may have a little surprise with regards to that coming forward for our viewers to hear and understand. But that's generally the consensus of the several reports that I've read, international reports in regards to healthcare and where we are currently. So let's measure that to where we are, or where we should be actually, in the year
Mhm.
2030. Oh, I forgot this graphic. This graphic indicates where we are in regards to spending funds according to several of the goals. And you would
Mhm.
see not. clearly there isn't 17 goals here. There are several goals highlighted here, and it means we some of the goals that we're working on has taken a back burner towards the development aspect.
Hmm. So in the case of health, are we reading number three is good health and well-being, right?
Right.
And according to this, we're only investing 5.4%
Out
of
of
our
6
total.
million US allocated towards the goals.
Hmm. So this is not necessarily about the budget, the overall budget, but it's about
No,
monies that are
it's
allocated specifically under the SDG heading to deal with
correct.
some of these. Okay,
So
I'm understanding.
certain grants and certain sponsorship that we would have gotten as a country to work on the goals this year
Hmm.
has amounted to 6 million US dollars. And that being said, this is where the allocations are going for the year 2023.
I
Because
noticed,
2024 hasn't finished, so we don't have
right.
2024 report as yet. We go back to 23.
I noticed climate action and responsible consumption are above 20% each, and then you have life below water with 17%. But
Mm-hmm.
I actually, this is so interesting to see how monies are being allocated. And if I understand correctly, this may not be a function solely of what is made available, but it is actually what we apply for as a country. I
Yeah,
remember reading that there are unutilized funds, or the funds are underutilized, because at the end of the day the country has to apply and has to set the policy agenda. So there's
and they
possibly
have
more
the
money that
yeah,
could have been accessed.
correct. And
Okay.
or we could have gotten less. So we must say that they did well to receive 6 million, but 6 million alone isn't enough to build a developed nation. So you need to ask the question, or persons should be asking
Mm.
the question, whether it is they sold the idea to the UN that the budget that they did would account
Mhm.
for what it is they didn't receive, or whether it is they were not efficient in selling what policies they
Ah,
want to implement.
right. I am following you.
Now, that's just my opinion. I don't know how it went. Disclaimer, I am not saying what the
Well, yes,
government did or they didn't do.
we haven't assessed, but these are the questions that other citizens could be asking, and some might have the answers out there. Our role is to present the data as it stands, and in some cases, we will go below the layer and unbox it further. In other cases, given the time span of this podcast, we would focus on certain areas remaining high level for your reference. But we encourage you to do your own research and dig a little bit. So where do we go
Alright,
to
so if
next,
we can move
Anarion?
on to the next image, right?
Yes.
Alright, so out of the 2030 vision, this is outside of policy number one, which is talking about nurturing people first, our greatest assets. And what
Okay.
it basically says in the document is that there are several plans for the country in regards to healthcare. So, one is universal access to quality healthcare. The plan emphasizes the need to improve and provide high quality healthcare service to all citizens, ensuring no one is excluded due to financial constraints or geographical location.
All right.
So, if it is you look at this, there is the SDG goals that align with this in regards to no poverty, quality healthcare, and gender equality. So those indicate
Understood.
there's no discrimination and no bias when it comes to the healthcare aspect.
Understood.
Then we move on to preventative healthcare, where they want to do a major focus. Where major focus is placed on promoting preventative healthcare to reduce the prevalence of NCDs. Same
Right.
thing we were talking about with regards to education and moving more forward with regards to it, right? Thirdly, there
Mm-hmm.
is going to be healthcare system efficiency. The Vision 2030 seeks to improve the efficiency of the healthcare system by upgrading infrastructure, reducing waiting times, and enhancing patient care delivery. It also talks about involvement of better management of resources because, Rudolph, if you know, or for our viewers
Mm-hmm.
out there who don't know, a lot of our CDAP medication right now that is being distributed to those who can't afford is expired. So that needs
That was
to be looked
that
at.
was alluded to in the debate, and that there was a heavy cost in terms
Hmm.
of the wastage.
Correct.
So
Now, if
this just a minute. So this is pulled out of the Vision 2030 document, which viewers can Google and find quite easily online.
it's there
And
actually a tab on the Ministry of Planning and Development website, so you can go directly to that website.
we're literally just under 5 years away from the benchmark, right? Because we're
Hmm.
supposed to achieve these things based on the years that I'm seeing there. So there are long, medium, and short term goals.
That was
So,
supposed to be implemented since 2016.
how are we looking, Anarion? I know you mentioned a few. Just by listening to you, I know offhand that we're not there yet. So even if you
We're
take just
not
the short
there.
term alone,
Hmm.
like number one, our society will be grounded in the principles of social justice. We aren't close to that, and we're already past 2020.
True, very true.
Number
But I
three,
don't want I
citizens
don't
will have
want business to
access.
take
Mhm.
away from the healthcare aspect. So let's focus on the health topics within the document.
So, also, just to be clear for our viewers, this theme does not deal only with healthcare.
No, it deals with all of those 17 goals you see underneath. There's 3 and 3, 6, 7, 8. This aspect deals with 8 of the 17 goals.
All right. So, if so, what you were speaking about, okay. So, for example, under short-term goals, number
Hmm.
four, that's where you were saying the healthcare system will be sustainable and modern and deliver higher standards of healthcare. So
Correct.
that should have happened by 2020.
Correct. And the issue that you would hear a lot of line ministers and a lot of persons talking about is the 2020 pandemic. Having a prevention of that and that the economy is recovering. We're still spending funds to recover and to pay off debts for various aspects of the pandemic.
Okay,
So
but 2020 was the end of the short term. So
so it
up
should
to
have been implemented
2019, we
before.
should have been there.
Correct.
And I mean, I live here in Trinidad and Tobago, and the healthcare system was far from sustainable and modern in many regards. Now, to be fair, there are elements of the system that are sustainable and are quite modern, but
Right.
that is few and far between. And what we're talking about is consistency at all levels. Primary healthcare, as you said, preventative measures. Then you also have outpatient facilities. You have specialist services. That came up in the debate as well. That we still have citizens who have to travel abroad because they
Right.
don't get the most modern treatment here.
Of course. And if we go to the next image, Rudolph,
Sure.
you will see this one talks about environmental, placing the environment at the center of social and economic development, where
Right.
goal number 3 also falls into this, which is health care and wellness and well-being. This talks more along the line of things like mental health and integration of technology
Understood.
and
Right. Right.
the preparedness for health and resilience, which is what the COVID-19 pandemic brought forth, as well as the
Mhm.
most. opportune or the most important part of the healthcare system, which is the human resource development and the training that their workers would need.
Well, again, I mean, you just open this document and you take a simple page like this. This is not difficult to follow. It is quite straightforward, and you can, as a citizen, assess it using your anecdotal information. As I said, we all live here, we read the newspapers, some of us engage with the healthcare system directly, or we have friends and family who do. You can gauge where we're at, and the timelines are right here. So you just ask yourself, where were we supposed to be at this stage? Because we're going into 2025, so that would be the outer layer limit of the medium term goals.
Correct. And I think by having just discussed some of the international reports and looking at where we should be and where we are, we've set the tone now for the actual debate within the parliament for the past couple of days.
So
So,
yeah,
do you
I
want to
think
take our viewers to there?
let's go straight into the Honorable Terence Dial Singh, Minister of Health's opening salvo for his contribution to the Standing Finance Committee discussion, which took place after the initial budget reading and the debate that ensued. So persons would remember that, and so just to remind our viewers, you would have had the budget presentation by the Minister of Finance, which we covered. You then had the opposition leader's response, which we also covered. And then you would have had an initial debate that took place. And after the debate, as Anarion said, you then have what is called the Standing Finance Committee portion, where different line items within each head, so a head refers to the ministry, each head is broken down into line items, and persons get to ask specific questions about the variances in the line items. So we're going to take in the contribution of the Minister of Health to the debate first, and then we look at some other areas, other takeaways. So let's hear what he has to say.
Let me tell the public now where the money gone. So the Ministry of Health would have received $7.5 billion. If you back out from that the PSIP, you are left with $6.4 billion in recurrent expenditure. I had the finance division run these figures with me. Of that $6.4 billion, Madam Speaker, the RHAs get 67.1% of that. So the RHAs get $4.2 billion. Of that $4.2 billion, salaries and wages account for 86% of that. So that's $3.7 billion in salaries and wages for 21,943 workers across the health system. Sorry, 21,777. That is the total employment figure of people working in the RHAs and the Ministry of Health. Of that 3.7 billion that goes to the RHAs, that does not include the Ministry of Health and its vertical services. So add another $270 million to that. Our total wage bill out of our recurrent of 6.4 billion is 3.9 billion, or 61%. The money goes into the pockets of 21,777 citizens of Trinidad and Tobago. That is where the money goes. Into the pockets of those people so they could pay their rent, their mortgage, their car loan, their grocery bill, their tea and tech bill, their WASA bill, send their children to school.
So that is an interesting statistic. I mean, it's just some back of the napkin mathematics, and you're looking at about $12,000 to $14,000 per month for each worker. Now, of course, not each worker gets that. I'm sure you have a wide cross section of wages from support staff, administrative, doctors, specialists, etc. But people, when they hear the billions of dollars, they probably don't consider, Anarion, that you have to pay people's salaries to provide the services for you. So when people complain that there are no machines or beds or medications, or there may be no plasters one day, or splints or crutches or supplies, they say, well, so much money has been allocated, but it's not only for the actual medicinal, what do you call them, there's a word for it, it's escaping me right now, but the items that you have to use in providing healthcare consumables, that's the word I was. So you have to pay people for their expertise.
Yeah, I remember during late 2020, early 2021, mommy went into the hospital. And at that point in time, funds were being funneled towards bringing persons home, securing the border, doing vaccines.
Yes.
And as simple as Panadol, they told us we needed to buy the Panadol for mommy to bring it into the hospital. So something that costs $5 a box with a card, box with like 40 or 50, you had to go and buy one side. But there are circumstances and situations that take that into consideration outside of just salaries. You need electricity and water to run the hospitals, because you need to sanitize, you need clean spaces, you need power in regards to the beds, with regards to power and oxygen,
you
and
need detergent to clean the linens.
Correct. All those things add up, and that's where, when we did education the first time around, we showed you guys how there is recurring expenditure.
Yes.
And education was nearly 80% of the allocation. Look, Terrence here just said it was 61%. So there's still at least 39% of the expenditure, the allocations that goes towards development. But I don't think he mentioned pharmaceuticals as yet. So
let's see, he goes on to speak about some other things now. Let's take in a little bit more.
There's always this hue and cry to it. But I'm going to counter it by conceptualizing what we are doing to make the process in health better, whether it's oncology, lab information, imaging, or e-prescription. So we are focusing on people, process, and product. We are going to start to infuse our processes and our people with technology. And I want to recommend and recognize two people. One, Ms. Reshma Mahipat, President of the Society of Radiologists, Radiographers of Trinidad and Tobago. She said in her president's address, "This year, our conference theme is improving patient care in a time dominated by technology. It is essential not to use the human touch." And I could not agree more with Ms. Reshma Mahipat. Madam Speaker, I am so proud when I attended the Republic Day Awards at President's House and saw all those fine citizens receive the awards. But as Minister of Health, you always pay attention to the doctors who get awards, and I congratulate them all. But there was one person who, for me, stood out, not a doctor. That person's name is Ms. Nadia Miraj. She got the Medal of Merit Gold for healthcare in the field of medical laboratory services, spanning a 40-year career. I want to congratulate her and mention her name here. Because in this process of modernizing, we cannot do it without people like Ms. Reshma Mahipat and Ms. Nadia Maraj.
So, Anarion, he's talking a little bit more about the people, but he's letting on that they intend to invest this year in a lot of technology and the digitalization of the healthcare sector, which you alluded to in your opening.
Yes.
Now, if you listen to the full contribution by the minister, he did spend some time to talk about that and the fact that they want to be able to ensure that patients' records are maintained in one frame and that you can access them across the country and the of course the infrastructure that is required as well as the human capacity to manage that type of mainframe and database and system. So he did go on to speak about that, and again, we we have to wait and see if this year Trinidad and Tobago will finally move to that milestone because this is not a new idea. As a matter of fact, I have heard this for more than 15 years as a national priority, the digitalization of our health records at least. And then of course the all the other systems that go along with it. Now he did mention in the debate, at least someone did. I want to think it was him. He mentioned some of the robots that we had
Right.
paid
Yeah.
for, or maybe it was the Minister of Finance. So now there are, so as I said, I want to be fair, there are things happening in the healthcare system. Some things are more digitalized than others. But
Hmm.
again, uh, for the average person out there, we're still having too much risk because of manual systems and records being lost and the lack of interoperability between one arm of the health service and the other. So that is this is an important area for us to look at as citizens. Let's see
Of
what
course.
else he goes on to talk about.
We are trying to move from paper heavy to paper light to paperless. We have gotten opinion from the Honorable Attorney General that e-prescriptions is legal under the current laws of Trinidad and Tobago. And we have started e-prescription writing in inverted commas at many of our facilities. It's at Arima, Mount Hope Women's, it's at San Fernando, it's at St. James, it's at other, on the Southwest, they pioneered it. Their 5 A&Es are doing e-prescriptions. It's at Arima and ERHAs to begin. What that means is that a physician seeing a patient simply types a prescription on a tablet or a device and it automatically goes to the dispensary. You don't have to walk with paper. The younger doctors and some of the older ones love it. They call it the bomb because they want to use technology. They call it the bomb. Patients love it because it decreases their waiting times. Madam Speaker, I mentioned Ms. Nadira uh, just now for lab information system. What we are doing is networking all our labs and networking our PAC system. PAC simply means picture, archiving, and communication system. To the layperson,
So there you go. That's where he went into a little more detail about it. Some of the ideas. Again, not nothing new under the sun. Things that exist in other places. I mean, in the private healthcare system, this is par for the course. I can tell you personally that my general practitioner has all of my reports and scans and x-rays over the last 15 years in one folder. When I went to my dentist a few days ago, she has all of my files on her computer system, and she was actually able to pull them up and compare and contrast. So for some of us, we have been experiencing this because we have certain privileges or we can afford, a higher level of service. But I personally want to see this for all of our citizens, as I'm sure you do as well, Anarion.
Yes, really, that is something that I am most interested in because they say time is money, right? So if it is you cut down on the time. Now
Hmm.
that he spoke about the prescriptions, I didn't know that existed because most recently when I was in the hospital and doing stuff with
Hmm.
regards to mom and whatnot, I was given hard prescription, written prescriptions. So I don't think it's
Still,
implemented
yes.
across the board.
There you go. There you go.
But what he is bringing across some very interesting points that seem to resonate with both you and I, and what the UN and what Vision 2030 looks forward to. So let's continue.
Well, let's hear, yes.
Have been against CDAP. They have been attacking CDAP, the quality of drugs. It happened again in this debate by Carney East, and yesterday to some extent by Kumuto Manzanilla. Madam Speaker, I know this is not going to be the end of it, so I can't say I hope this stops today. But I'm going to put on the public record how drugs are developed and how they are approved for sale in Trinidad and Tobago, including CDAP drugs. So the drug development process, step one, discovery and development. Two, preclinical research. Three, clinical research. Four, FDA review. We do not put any drugs onto the formulary if they have not been approved by what we call a stringent authority.
So there he was treating with the accusation that somehow there were substandard drugs being offered in the public healthcare sector, and of course by extension that would be a waste of money and putting people's lives at risk, etc. So he's making the case that they utilize properly vetted drugs,
Hmm.
and those are the only drugs available both in the private and public or should be available in the private and public healthcare
I
sectors,
I
and they
can
are expensive.
attest to that though. That so, for example, gravel. We all know what gravel is and what gravel
Hmm.
does. There are two type of gravel out there. You can go and you can pay $1 for a gravel tablet, which has the drug, the basic drug that gravel contains, and then you can go and you can pay $4 for an original gravel.
Yes, so either a generic or the brand name version.
Correct. And what the public and a lot of people fail to realize is the you get the generic true syrup. You
Hmm.
don't get the original true syrup because of the amount of drugs that is dispersed on a regular basis for the amount of diseases we have in Trinidad. I don't think the country could afford the original brand. But it's like
Right.
wearing a Nike versus wearing a
A no name.
Saucony,
A
a
no
no
name.
name. It still serves the purpose that you get from point A to point B. It's just based on style and what marketing value there is behind it.
So let's see what else he says here now.
Compliance is a major issue in treating chronic diseases like diabetes, hypertension, and cancers. Managing chronic diseases is not only taking medication. Taking medication is one prong of a lifestyle change. So, in other words, you can't take simvastatin like me to reduce cholesterol and eat chicken and chips 3 times a week.
So again, he's reinforcing some of what we talked about earlier,
Mm-hmm.
not just the medication after the fact, but what can you do along with your medication, or hopefully in more cases moving forward, what you can do even before to prevent you needing to take the medication. So it's a good point that he raised there. And then let's see what else is said in his speech.
And I quote, "The Pan American Health Organization wishes to congratulate the Republic of Trinidad and Tobago for the encouraging results in routine immunization coverage obtained over the last year, as reported in the estimates of national immunization coverage published by WHO and the United Nations Children Fund." This is us. We are one of 2 countries to achieve this, Trinidad and Tobago and Jamaica. So I need no advice from Sapari about vaccinations. None.
So he more or less summed up his contribution by referencing some data points and international assessments that, and again, it aligns with some of what you were introducing at your segment, where for all intents and purposes, when things are relatively compared, Trinidad and Tobago is not necessarily at the bottom of the barrel,
Of
but
course not.
the average citizen out there, the people who are suffering and dying, it would be difficult to justify to them that we're in a quote unquote good place. So again, we have to, as a citizenry, de- decide, are we really going to make the kinds of changes to ensure we meet the goals that are set out for us? And are we going to advocate for them?
Well, it's a call to our citizens to stand up for what is right, to be the voice for those who don't have voices, as well as be a voice for yourself. And if there are issues and there are concerns that you want highlighted that you're afraid of, there is an email address you can send it to. It's called we must do at ourpart.org, and we will raise the issue for you. We will unbox it, we'll research it, and we will shed the light,
Yeah.
because that's what we're about here for at our part, which stands for our portal of accountability and representation for Trinidad and Tobago. But moving on from the minister, we have the shadow minister, who is the opposition
Mhm.
representative for health, and that is Dr. Rai Ragbir. So we've selected a couple of clips from his presentation, and let's take a look at them.
I feel Dr. Rai Ragbir have to step down and give somebody else a chance, and somebody younger who could build this community. I end with that. So, Mr. Deputy Speaker, as a medical practitioner, I'm also a man of science. However, I'm also a man of faith who is guided by the teachings of our Lord Jesus Christ. I know that these are difficult times for many people in our land. There are many people who are losing faith in the political establishment. There are many people who have said otherwise, and they have selfishly put their own interests and their own party over the interests of the people of this nation. Mr. Deputy Speaker, one of the proudest moments in this honorable house for myself was my decision to vote in favor of the whistleblower legislation. Mr. Deputy Speaker, I did so because of my constituents have expressed concerns to me that they want to report instances of corruption, but they were afraid to do so for fear of reprisal. And let me just start off a little bit with that. While my earlier action in supporting the whistleblower legislation was concentrated on the damning allegations at the San Grande Regional Corporation, our fight is science and corruption.
So he's
Yep.
raising the
Hold up,
point
hold up, hold
about.
up. Your times. I'm Cyril off.
You didn't pause
I
the
was so
recording?
That's okay. I message in your chat which what I cut from. Um,
Yeah, but now they're going to take us a long time to get this thing out.
Of our already stretched thin health service to the breaking point. I agree that our healthcare workers must be commended for their professionalism they displayed in what was very difficult times for our country. But, Mr. Deputy Speaker, we must not forget that many of the issues, long waiting times, overcrowded hospitals, shortage of medications, and overworked staff, predated the pandemic, and it continues post-pandemic. I couldn't understand my colleague, member for St. Joseph. It's a very, very difficult task being in a medical practitioner. You could have someone who pays no taxes, does not work, gets in an accident, and the bill is 500,000 because you're in ICU for a month. And that's an example how health could actually reach to a bottomless pit.
well,
An
there you go.
excellent point, I think, raised by Dr. Ragbir. And I mean, you were speaking about citizens holding the government account. But at the end of the day, the opposition has a role, perhaps the first role in doing so. And I think he raised an excellent point here.
Of course he did, because, like I said, with regards to the reports and everything out there, it's based on a selection of persons that they would have done stuff on. And the public still complains, the public still sees long waiting lines and things like that to get access to medication, to even for clinics and things like that. You
Yes,
tend to have
yes.
to go there from 6 in the morning and drop off a card to see a doctor at 9. That's a 3 hour wait.
And also, people can't get preliminary testing, and their bodies are becoming more and more infected while they're waiting. So, whatever disease or ailment they're suffering with is not
Hmm.
being treated as quickly, and that can make a huge difference in your life expectancy and your ability to recover.
Correct. I remember there was a friend of mine recently who went to the hospital and they gave her a clinic date that she went in the hospital. I think it was June, July, somewhere around there.
Mhm.
And her clinic date was for March next year.
So, we can again say that we're doing well compared to other similar countries or even larger ones. But at the end of the day, it's 2024 October, and we have to make a decision if in the next 5 years before 2030, if we are serious about achieving these goals. And if so, how can we leapfrog? Because we're certainly not where we need to be. Let's see what else he went on to say.
Waiting times will continue to increase. But don't think the waiting time is only for Trinidad and Tobago. When you go to first world countries for little things, sometimes you don't get an appointment at the same time. You wait for hours. So I am now looking at my colleague here from Chaguanas West, as you mentioned about a hospital. Maybe it's a good time that we need to look at a hospital for Chaguanas because Chaguanas has the highest per capita rate of non-communicable disease, the diabetes, the hypertension, the cardiac disease, and according to Professor Anarion, the highest amount of diabetic foot amputations in the country. So we wait with a bated breath that in a forthcoming budget, we could see a new sugar on us hospital. And I shall continue. Medication shortages right now, Mr. Deputy Speaker. I can tell you what is short right now. Gravol, everybody know what Gravol is, dimenhydrinate intravenously. You can't get it IV. Alivian Duo, that's for IBS, irritable bowel syndrome. Frialta, that's for chronic kidney disease. Endometrium, that's a menopausal woman. Clara, that's an oral contraceptive pill. I prevent nebulizer solution. Detrocytol used for overactive bladder syndrome. Seroquel is used for hypomania and schizophrenia. Again, Mr. Deputy Speaker, the entire world is going through a supply chain crisis.
Wow, the supply chain crisis is real, and we've been reading about it in other parts of the world.
Mm-hmm.
If only some of those parliamentarians wouldn't be using all of the schizophrenic drugs, there might be more available throughout the world, not just in our parliament. But no, and on a serious note, we have to remember that we are at the mercy of the distribution chain. And if other markets are prioritized for distribution of certain drugs, we have to wait our turn. We don't make these things here.
No, and it's been a topic that's been on my mind in regards to our manufacturing sector that we should be able to do that because our medical and pharmaceutical schools in Trinidad see persons from around the world coming to get that training. So why can't we organize and prepare? We are some of the largest manufacturers and distributors of things like fertilizers and ammonia and methanol. So the same persons who design the plants, the same persons who run those plants could do a pharmaceutical plant and we could produce our own
That's an
medication.
interesting perspective. It's highly possible. I mean, even if we chose one specific drug
Mm-hmm.
and started creating a center of excellence here to produce that. I mean, obviously, as you said, you would need the intellect and the technical training to ensure that it's first world, but we do manufacture certain things that are exported at the highest standards already: food and beverage products,
Correct.
some light manufacturing technology, even services. So it's possible. I could see something like that happening if we were to again put our mind to it and focus and
Not
say,
only
listen,
not
we
only would it
need to be part of this value chain.
right, not only does it help the citizens, but it brings in foreign exchange. But let's continue listening to the good doctor.
He intends to get done on the health sector and so on. I have no issue with that. Any attempt to improve the infrastructure of hospitals, I'm sold. However, Mr. Deputy Speaker, I stress treating the symptom and not treating the disease. How patients can access care when they need it is one function, but the health sector needs to be more prevalent where persons will and be more looked at so that they will prevent it from ending up in the hospital. So we focus on primary health care. And the biggest health crisis we have here in Trinidad and Tobago, Mr. Deputy Speaker, is the explosion of non-communicable disease. I want to compliment the member for St. Joseph for launching the NCD hotline. That is a non-communicable disease hotline. It's 800-4, number 4, NCD. That's 4603. But, Honorable Minister, let us work together to manage numbers, and especially for our diabetic hypertensive, to take primary health care to the rural communities, which I'm part and parcel of, to embolden our primary care doctors, because many of my patients, Mr. Deputy, will come to me And they will say for months and years, their families and themselves will sit next to the doctor. The doctor will not examine them. We need to train our doctors, examine your patients, see how the disease process is progressing, and see what complications are developing, because the state will have to spend more on dialysis, cataract, heart surgeries. So we need to do it differently.
We need to do it differently. I couldn't have said it better myself, Anarion. Uh, that, we really do need to live differently, eat differently, exercise differently, see about our mental health and wellness differently, and as you just said, allocate differently to ensure that the right sectors are being reinforced and expanded so that these symptoms, because NCDs are really symptoms of other challenges and problems in the society that
Correct.
we can prevent.
Correct. And he spoke in that short clip about two things I would like to highlight, which are education for the general public on what NCDs are and how to prevent them. But he also made reference to the fact that we should work together. He's talking about both the opposition and the
Yes,
administration there.
yes.
And he's one of very few MPs on that side that advocates for the unison between opposition and administration for the betterment of people. And I don't want to let that go unheard or unannounced.
I agree with you. And it's across all divides, all aisles, classes, ethnic groups, religions. We really have to have this common vision for Trinidad and Tobago. Where do we want to be, not just at 2030, but further on into the future? Where do we want the country to be when some of us might either be older or not even here again anymore? So, Anarin, I know that there's a lot to unbox when you start looking at each sector, each ministry, each
Hmm.
industry in its own right. So we've agreed here at Unboxing TNT to shift our approach from this week. So we'll be having two-part episodes for each of the sectors. So today we brought you the debate component where the Minister of Health provided some additional color and the shadow minister from the opposition was able to raise some of their points of view. So on Friday, we're going to bring you the second part of this episode, where we will, as Anarian said, we will look at the Standing Finance Committee, where some of the line items were considered, as well as we're going to bring back some additional data points and information that we think citizens should be equipped with, as well as some policy recommendations.
Of course. And we remind you guys to stay tuned, tune in for more if the conversation is getting heated and it's exciting you like it's exciting us. I mean, my face mightn't show it, but it's exciting. And you hit that like and subscribe button, you will be notified when it is the episodes upload. And you can take a look at our budget debate um episode. Is it here or there? Somewhere on the screen here you can click and you'll be able to find that episode link.
Yes,
Um so take care, be safe, and remember, eat healthy,
yes,
exercise, and take care of yourself.
certainly. And we'll see you on Friday for part two of episode 10, where we are unboxing healthcare in relation to the budget 2024 to 2025 allocation.
All right, ladies and
Thanks.
guys, take care.